Hello, I'm Coleman, and I'm here live in front of the Lawrence Memorial Hospital of Medford. And inside here, there's another Massachusetts resident that has contracted the Ebola virus. The identity of the victim is not yet known, but we do know it is a young female, and she is isolated inside this hospital. We will inform you when we get more details when they are revealed to us. For now, I'm Kelly Coleman, World News.
Hello, Lucy. I'm your doctor, Mark Schuster. Listen, tests are in. And there's no easy way to say this, or tell you, but you have the Ebola virus.
But how? I've never even been to West Africa! That doesn't even make sense! I haven't even left the country!
Well, it says here in the file that you work at the zoo. Have you come into contact with any fruit bats, apes, antelope, or porcupines in the last week?
Actually, yeah, we had a new group of bats, and I was moving them into their cages, but one of them was sick, and so I brought it to my supervisor, and oh my goodness. Well, we gave the sick bat a shot, and I accidentally pricked my finger with the needle afterwards.
Lucy, it'll be okay. Your mom is in the quarantine, in the room right next door.
Wait, why is she quarantined? Can't I see her?
You can't see her right now. It's still too dangerous for her. Since you two are living in close proximity of one another, it is likely that she contracted the virus as well. We have to wait 21 days until it's clear that she does not have Ebola as well. I promise I will let you see her as soon as you can.
Hello, I'm Kelly Coleman, and I'm here live outside Lawrence Memorial Hospital of Medford, where we have confirmed the identity of the Ebola patient inside. It is 17-year-old Lucy Hayes, and she contracted the deadly virus while working at the Stone Zoo just a few miles away. It is said that she got the virus after pricking her finger with a needle that was used to give a sick fruit bat a shot. We will keep you updated. With World News, I'm Kelly Coleman.
Hi, Miss Haynes.
Hello.
I'm Dr. Mark Schuster, Lucy's doctor. I'm sorry I have to tell you this, but your daughter has Ebola.
Oh, my poor Lucy.
Ma'am, we have some of the best doctors in the country here to work on your daughter. We were working around the clock to try to find a cure. We have something that we are going to try. It worked for the man in Worcester, so hopefully it worked for Lucy. As for you, Miss Haynes.
Please just call me Heather.
My apologies, Heather. We're going to need you to stay in quarantine for the next 21 days to make sure that you do not develop any symptoms. We will not know if your doctor infected you until you show some symptoms.
What are the symptoms?
The earliest symptoms could show are headaches, sore throat, muscle pain, fatigue, and a fever. Next, you could develop diarrhea, vomiting, rashes, and possible signs of liver and kidney failure.
Have
you had any of these?
Not that I recall, but what are the symptoms of kidney and liver failure?
They're pretty much the same as any other symptom of Ebola, but that is good that you haven't had any. Now, can you remember when your daughter's symptoms started showing up?
Well, she was at the zoo on Sunday, and she pricked her finger, and then on Wednesday, she had a headache, so she stayed home from school, so I guess Wednesday?
Thank you, Heather. But this, seeing how today is Thursday, you have been exposed for 5 days. You only have 16 more days of quarantine to go. I'm going to check on the treatment for your daughter. I will let you know when we know more.
Thank you very much.
Hey Mark, glad you could make it.
Hi, Mark.
No time for small talk, team. What can we do to make this girl better?
There are trials for the vaccine currently going on, but I believe it is too risky for a patient. She's only a teenager. Here's the files.
What are you saying, Beth? Have you not seen how many people have died from this disease? Why not try something out, and if it fails, do something else?
We just need to treat each symptom individually and keep her on an IV. If we make sure her oxygen levels, electrolytes, and blood pressure stay within a normal scale, we can kick the virus out of her system.
No, we cannot do this to a little girl.
Why don't we try what the hospital in Nebraska did for the soccer guy? They put him on a TKM Ebola test drug and gave him a blood transfusion from a survivor. Going with both methods was what helped Sacker survive. I am the chief of infectious diseases. I think we should go with my idea.
Yes, great idea. I'll get on the phone now so that we can get both the blood and vaccine now.
Don't forget to check your blood type.
I won't.
This is a bad idea.
Why? It worked before.
It's not that it hasn't worked, it's just we won't know what has worked.
What do you mean?
We won't be able to know what cured her. Doing it this way won't be able to help other people.
Right now, all we care about is helping Lucy.
All right, thank you. Bye. Yes, we've got the treatment.
Hello, I'm Kelly Coleman, and I'm here today with Dr. Mark Schuster. He is the doctor of 17-year-old Ebola patient Lucy Haynes. Doctor, how are you today?
Very good, Kelly, very good. I just got off the phone with the hospital in Nebraska that is sending us the same resources that were used to cure Dr. Richard Sakra a month ago. We are in very high spirits right now.
Can you tell us a little more about these resources?
Well, Kelly, what we're getting is a new drug called TKM Ebola, along with the blood of an Ebola survivor. With the drug and the blood combined, we will be able to put enough antibodies into Lucy's blood to prevent the virus from taking over new cells.
Please, tell us a little more about the TKM Ebola.
The TKM Ebola drug was fast-tracked by the FDA in March, which means that they funded it and wanted to get out to patients as soon as possible. It is currently the only drug they're allowing patients to get, even in small amounts. The U.S. Department of Defense and a company called Techmira have been working very hard to get this drug to cure those infected. That is all I'm able to say on it, though.
Can you tell us a little more about the Ebola virus itself?
Well, the Ebola virus originated in fruit bats in West Africa. The first cases were reported in 1976 in a small village just off the Ebola River. That's where it got its name. Humans can become infected when they come in contact with bodily fluids of someone or something that is infected. Our patient, Lucy, got the virus from getting pricked by a needle that was used on a sick fruit bat. She was exposed to its bodily fluids, in this case, its blood, and she contracted the virus.
How is this virus able to spread so quickly throughout West Africa?
Someone in the home is initially getting sick, and then other family members are cleaning up after them without the proper protection. The virus thrives on finding new hosts that come into contact with infected bodily fluids, like vomiting.
What are some symptoms of the virus?
The first symptoms to show up include fatigue, muscle soreness, headaches, and a fever. Next, there'll be diarrhea, rash, vomiting, bleeding, and signs of kidney and/or liver failure.
How are symptoms like headaches and vomiting going to kill someone?
Well, these symptoms aren't actually what kills you. Towards the end of the virus, what ends up happening is that your immune system cranks up to its maximum capacity, warding off the virus but leaving a painful side effect in your body. What it does is it makes the walls of your blood vessels thinner and more permeable, and your blood starts leaking out. Your blood pressure continues to drop until it's at 0. Then, you're dead.
Wow. Okay, that's all the time we have for today. Thank you, Dr. Schuster, for speaking with us.
It was my pleasure, Kelly.
Kelly Coleman, World News.
Lucy, I have something to tell you.
What is it?
Lucy, I am pleased to tell you that you are Ebola-free.
Really?
Yes, congratulations.
Wait, then why are you still wearing the protectors?
Even though the test came back that you are no longer infected, Ebola can live on surfaces for days. Anything in this room that you touched has the virus living on it. To keep myself safe, I wore the suit.
Since you have it on, does that mean I can hug you?
Of course it does.
Hi, I'm Kelly Coleman, and I'm here live in front of Lawrence Memorial Hospital of Medford, where Ebola patient Lucy Haynes has been released from the hospital and deemed Ebola-free. She was isolated and treated in this hospital for 21 days and is coming out completely Ebola-free. She was given both a trial of the new Ebola vaccine, TKM Ebola, along with receiving a blood transfusion from an Ebola survivor. Congratulations, Lucy Haynes. With World News, I'm Kelly Coleman.